Hello, everybody. This is Kyla here from Nutritional Revolution, and we have an amazing guest here today with us. We also have our executive assistant, Nia, tuning in to chime in with some questions through today's podcast. We have Dr. Kimberly O'Brien. She is a clinical social worker in the sports medicine division and female athlete program at Boston's Children's Hospital. And she's a research scientist and assistant professor of psychiatry at Harvard Medical School. She is a rock star. So thank you, Kim, so much for popping on here today with us. We have so many questions for you to dive into. But first, why don't you tell us a little bit about yourself and how you got into this area of work?
Sure. Well, I'm a social worker by training, and I got into the athlete space more recently. Prior to the athlete space, I'd really done a lot of work on intervention development for suicidal teens and teens of substance use. But really, I'm an athlete at heart. I played hockey in college and, still play a lot of sports today. And it's always something I knew I kind of wanted to get back into once I had the expertise and the skills I needed to do so. So a couple years ago, I reached out to Kate Ackerman, who's the head of the female athlete program, and she, I asked her, what mental health work they were doing, and at the time they weren't doing any. And so we made a really good connection, and I've been with them since. And so that's kind of what brought me to the female athlete program. And then on the side, I have a group private practice for athletes. All of our clinicians are athletes, and everyone we serve are athletes. Wow. So I kind of do that on the side, which is, both experiences together have been awesome. And doing a lot of research now on psychological resilience among female athletes.
Amazing. Wow. And that female athlete program how does that work? And is that just for teen female athletes, or who can have access to that?
So we see anyone, youth, recreational, all the way up to adult, elite, professional. So it's really a wide range, but it's basically anyone who identifies as a female athlete. And, we want to make sure everyone understands that does include transgender individuals as well. And really anyone who is having some concern at all related to sport. It could be a medical concern, it could be mental health related, it could be nutrition related. So it's a multidisciplinary program. We have social workers, psychologists, registered dietitians. Amazing. We have MDs and physician assistants. So we have there's a lot of us together working on how to treat the athlete in a holistic way.
Wow, I love that. Yeah, it is a well-rounded approach. I think it's necessary. And I mentioned this to you before we started recording too, is I always think about with my schooling, we did not get enough of the other pieces of the puzzle that go into nutrition, right? And there is such a big mental aspect to that. With the female athlete program, do people have to be located in Boston to access it?
No, you can be out of state, but in terms of who we see, it really depends on what our licensure requirements are. Like, for instance, for me as a social worker, I'm only licensed in Massachusetts, so I can only see people in Massachusetts. But that's not the case for all of our clinicians on staff.
Cool. Okay. That's helpful. And so before we kind of dive into everything on different types of maybe mental health concerns and things like that, can we first dive into like biochemically what is happening in the body when someone maybe is experiencing like anxiety or high performance stress? Can you dive into that and tell us about that?
Yeah, I think in terms of what's happening in the body, I mean, when we perceive a threat of any sort, it can, trigger a response, like a nervous system response. And that is really what kind of we're talking about when we're talking about anxiety, when we feel like a physical sensation. It doesn't always have to include that, although it can be more worry based, which is more cognitive, more with respect to thoughts. But performance wise, there usually is a huge component, physical sensation component to anxiety, and that can get in the way of an athlete's performance if not harnessed correctly.
Mm.
The thing though that I always like to say to our athletes is like, it's normal to be anxious. So
Yeah.
it's what we don't want to kick the anxiety to the curb and have it be totally gone, but it's
Mhm.
more about like recognizing it and having it work for you rather than against
Mm.
you.
Mm-hmm. Can certain levels of anxiety increase like focus a little bit, or can it go too far and almost make the focus hard?
Yes, is a really interesting graph. I wish I had it. Maybe I can send it to you, but
Yeah.
it shows like on initial levels of anxiety are really, really helpful in helping you achieve your goals, you know, getting you motivated, helping
Mm-hmm.
you to, you know, get that surge of adrenaline. But there
Mm-hmm.
comes a point where if it gets too much, it can have negative effects, right?
I
Like you could
see.
freeze up, or you
Yeah.
could, you know, that fight or flight
Mm-hmm.
can happen. So it's a really, it's important to be able to really understand your body
Mm-hmm.
and your mind, and what is a healthy level of anxiety for you, and one that can drive you to succeed,
Yeah.
and when it gets to the point where it's actually inhibiting your performance or it's having a negative effect.
Yeah. Makes me think of public speaking. Like you
Oh yeah.
can get nervous and sometimes it can help you like really hone in on your notes and like delivery. But then, yeah, like you're saying, you could freeze up or you, some people faint, you know, it can be a
Yeah.
little bit more extreme. So when that is happening, is that a release of cortisol that can get like overwhelming, like causing someone to almost like faint or choke up or?
I think it's and you know, I not being you know, an MD, I can't speak to the exact specifics of what's happening within
Mhm.
the body, you know, physiologically and neurologically, but I can, you know, speak to what is happening for athletes in this moment.
Mhm.
Is if the emotions and physiological experiences they're having are perceived as overwhelming,
Mhm.
and you know, that could either be perceived cognitively, the way their mindset around it, the way they're the way they're experiencing it, how they're you know, experiencing it in the moment. If it feels like too much,
Mhm.
then it can really you know, push someone to the point where their performance can be inhibited, like they could tighten up, or they could,
Mhm.
you know, things like that may happen. And the heart rate, you know, your heart rate will, those are some of the things you might feel, like increased heart
Yeah.
rate. You might get really sweaty. You might get, you know,
Mm.
there are a lot of different things that can happen within your body, but it's important to know that's different in all athletes. They experience
Mhm.
anxiety differently.
Yeah.
Some completely shut down,
Mm.
and so rather than, you know, feel like they rev up. So it really,
Mhm.
anxiety is different for every single person, and the
Yeah.
key is for individuals to really understand themselves and be able to identify that it's anxiety, because it can be
Yeah.
even hard sometimes to even identify that that's what's actually happening.
Yeah. Yeah. With our athletes for sure in the endurance world, I know there's that race week anxiety. There might
Yeah.
be some people get the digestive system speeds up, some people the digestive
Mhm.
system slows down. Do you see that a lot in your practice or
Oh
in your
yeah,
athletes?
absolutely. We definitely see that a lot. And yeah, I would agree, especially with like our runners and things like that. I mean,
Mhm.
it's something that people have been working up for so long, and
Mhm.
so it can feel overwhelming, all these
Mhm.
emotions that you have around it. And if you
Yeah.
don't have, if what I think happens too is when people try to fight those emotions off, like they
Mm.
fight off the anxiety or the stress, rather than just recognizing it, accepting it, and like breathing
Mhm.
through it and riding it more like a wave.
Mhm.
That's when, you know, when you fight against it, that's when it comes right back at you like a boomerang.
Oh,
So
shoot.
that's the
Yeah.
big thing that I like to work with athletes on, doing specific performance based anxiety.
Awesome. We will dive into that towards the end here. We're going to give Kim some case studies that I have personally had my athletes experience, to hopefully give you guys some tools that are listening. So we do run into a lot of issues with our long distance endurance athletes having low energy availability. We have had athletes who have come to us who have had past histories with eating disorders, things of that nature. How does that connection, how does that manifest itself mentally, and what could be going on
Mhm.
there?
Yeah, we see this is really what we specialize in at the female
Mm.
athlete program, and what we have is like a multimodal approach, because we have, you know, the medical piece, the nutrition piece and the mental health piece. And we all, work together to help the athlete because, red S is like it's a big issue in, in a lot of sports, especially like running and sports like that, where you really see it a ton. So how do we work with it? Well, the key is that you want to make sure you're identifying, you want to make sure you're medically ruling out everything and making sure everything's, okay, from that perspective. And then obviously nutritionally, you need to target that piece. And then alongside that, there's the mental component, which is really what the work I do. And it can look really different in a lot of athletes. Some athletes, the low energy availability is related to disordered eating or an actual eating disorder. And so if that's what's happening, then there's a lot of evidence-based treatments that we can do for eating disorders. So that's some of the work we might do there. But some of it too is, there's so many different aspects to this that it's really hard to boil it down to just one thing. Like it's not just anxiety or depression or any other mental health concern. When it comes to low energy availability, it's not a one size fits all approach. From the mental health side.
Yeah. I will also say too, that we've definitely had in the triathlete world, I mean, these athletes are putting in so many hours of training, and then maybe there's suppression of appetite post training, and there's almost an unintentional underfueling going on. They don't even realize it. And that is potentially a whole other area. But I also see too, there's a lot of like, I don't know if the right word's type A, like, they really are like high achievers and kind of lend themselves towards like having to like do, like they have their training schedule all set out, they nail it, ABC, check those boxes. And then with the nutrition side, many times they want to try and make sure they're eating as clean, like air quotes as possible. Right. And
we
it's
see
a lot of veggies and sets them up to potentially unintentionally underfuel or to some extent. Right. So I have a question for you, and I think I know the answer, but I just want to ask it so you can, be the boss on here. But do all eating disorders have a psychological component?
I think everything in life has a psychological component. So I don't know. I mean, how do you take that out of anything? Whatever it is. So I think you always need to look at what the psychological component is to eating disorders. But you were talking earlier about unintentional versus intentional underfueling, which is, I think, a really important point, because a lot of times athletes will come into us and, they'll first usually come into the MD and then they'll get assessed for what's going on. And they may find out that they've been unintentionally underfueling and are able to make changes like that with the nutritionist. And there's not really an indication for a need for mental health support there.
Right.
But there are, I would say, more of the cases are once they, even if it was unintentional underfueling, once the refueling, begins, then a lot of times a lot of mental health concerns can come up, like anxiety about, am I eating too much? Like, this is a change, and what does this feel like? And so at that point, we might come in and just see how we can support the athlete and understanding what the concerns are. But in a lot of most of the cases we see, there is an eating disorder present. And a lot of eating disorders in sports like running, gymnastics, figure skating, just to name a few, these are sports where thinness can be seen as an ideal. And I'm not just talking like within a team, on social media, like there's just so many ways in which or regular media, like we see athletes who win races and we look at their bodies and we compare their bodies to ours and should I be thinner? And so if people, are doing that, then it can give them a lot of anxiety about their food intake. And that can ultimately contribute to a lot of eating disorders in athletes.
Yeah. I think we see that too with the running and triathlon, is the whole thought that like lighter must be faster. And right. And so that affects that energy intake perspective and thinks that just losing a little bit more, it'll maybe be easier on the joints and it'll feel lighter and they'll run faster. And yeah, many times we see when athletes just start fueling better, one, they're not getting fractures every year and they're able to keep training, but also their performance increases and they're performing better at a slightly heavier weight, which is scary for a lot of people, I think, in the beginning to get there and accept that. There's that fear of maybe I'm going to get slower, or, but I think at least from our side, honing into on how they're feeling, how they're performing, all of that can be a game changer when we start focusing on something other than the number on the scale can be really helpful. Yeah. So you kind of mentioned the figure skating stuff. Out of curiosity, do you see certain types of disordered eating or eating disorders more so in certain sports, like anorexia versus bulimia?
I would say, I'd say among athletes, the primary eating disorders we see are anorexia nervosa and bulimia nervosa.
Okay.
I think we do, because really, you can have anorexia nervosa with binging and purging though. So what's different though about anorexia nervosa with binging and purging versus bulimia nervosa, which is, having binging and purging, the difference is the extreme low body weight for those with anorexia nervosa. I mean, I'm oversimplifying it, but so if we look at that and you really look at the sports where you see more thin athletes, it tends to be those sports. We don't often see, like in my sport, hockey, like anorexia isn't super common. It happens. But it's not as common as like figure skating, where I almost would argue that a majority of the athletes may have anorexia nervosa. I'm not going to make that statement because I don't know, but what we see so much of it, so we're a little bit jaded in what we see. But it is something where the culture of figure skating, the culture of gymnastics, some of the coaches and what they preach to their athletes and what they tell them to do with respect to their diet, it can contribute. So it's not about that individual athlete, it's about the whole culture of the sport and and how it contributes to disordered eating behaviors.
Do you feel like you've seen a change or increase in disordered eating clients with social media and all of that stuff?
I have to say, I saw the biggest change with COVID, and that's because I work mostly with teens. So for me, and I'm just speaking anecdotally, not from research, but I saw with on TikTok back when COVID first started, there were these things like what I eat in a day and those challenges and things like that. And people would post what they see. So they'll show like a handful of almonds and that's what they ate in a day. Then other teenagers are seeing that and they're like, well, I'm going to do this. And so then, and then the other thing that coupled with the fact that all these athletes were taken out of their sport, the majority of them right when it hit, when there was quarantine, they had nothing to do with the energy they had, like their normal, they didn't have that outlet anymore. And so a lot of these people, like you talked about being type A earlier, like kind of like perfectionistic, these people, those of us with perfectionism, we need goals, we need things to strive towards. And so for some people, the only thing they could really go to was eating and exercise on their own, so we saw so much of that. We saw a lot of people, teenagers lose a ton of weight over COVID, and that's the biggest thing I've seen lately. And I'm not sure how much better it's gotten, to be honest.
Yeah, shoot. Yeah. COVID hit a lot of people really hard in different ways. I imagine teens, like you're saying, access to social media, but then being confined to the home and less social interaction. And the social interaction becomes reliant on social media. And that's brutal.
I'm actually curious. I remember hearing about seeing a lot of people self-diagnose themselves on TikTok and on Instagram and stuff. Did you see a lot of that happening too, especially during COVID when everyone was living online?
Yes. And I think people have always kind of self-diagnosed themselves. Like, used to be you like WebMD yourself, and then now it's all over all the socials. But I do think, people notice, like, things about themselves, and now we just have it at our fingertips. We can just look online and be like, what does this mean? What's this a symptom of? And like, so I definitely think we saw a lot of that. And that kind of brings up a good point though, about labeling in general and diagnoses in general. I kind of lean on the side of, I try to stay away from the diagnosis as much as I can. Not that there's any shame or harm in it, but just that in mental health work, what we're doing is we're treating the symptoms, not necessarily the diagnosis. So for me, it's not as important to find a label for somebody. Now, that being said, I have a lot of athletes I work with who, once they have a name for something they're experiencing, it feels empowering for them. And they feel like I can do something about this because there's treatments for it. So, I mean, I don't know, it is a tricky dynamic, a tricky thing to look at, but an important one for sure.
Yeah. Wow. Do you ever run into situations with clients that have been referred to you that don't think that they have a disordered eating? And so is there a process there of kind of maybe educating them on maybe what disordered eating behaviors are that they are doing?
Yes. So the approach I use with eating disorder treatment is a cognitive behavioral treatment for eating disorders. And one big piece of that treatment is the initial psychoeducation on what is regular eating. What does that even look like? Because some of them don't even know. They've maybe never been taught that, or maybe they have parents or guardians who eat in a way that is actually not very healthy, but they thought that was healthy growing up. And same with exercise. Maybe there's just this real emphasis on over exercise in the family that they're learning from. And so, and again, I work with mostly teenagers, so that this is that age where you're starting to learn like what your parents did isn't always necessarily the thing is the right thing, but it was how you grew up thinking your parents could do no wrong. And then as a teenager, you start to figure out who you are and what you want to be and how that might differ from what your parents do. Or other trusted adults. Yeah.
Are there things that the listeners maybe should be privy to in terms of, I mean, I think purging is like, I think most people know that that's a form of disordered eating, but are there other things that maybe listeners should be informed about to keep an eye maybe on them, on their own selves, to kind of like, what are maybe some disordered eating behaviors to kind of keep an eye on?
I think, and I'm sure you've talked about this, nutrition wise in your a million times in the podcast, but just the importance of like, having, if you're an athlete, I know it depends, but you want around like 3 meals, 3 snacks a day, or, and there's different amounts and things like that. So a lot of times athletes hear just that and they're like, what? Well, that's a lot. And it's like, it's actually not a lot, but they think it is a lot of the time. And so just telling them about that piece of it is important for psychoeducation. But then with respect to like the mental side of it, it's important that athletes understand when they're doing things that we call compensatory behaviors. So when, let's say you go out for a run, what is the reason why you went for the run? Did you go for the run because you genuinely love running and or you're training and it was your day to run and that sort of thing? Or did you go on a run because you ate something and you feel like you need to burn those calories? So like that same 5-mile run could be, healthy or unhealthy, depending on the reasons why. So what I do a lot with the athletes I work with is really digging deep as to like, why did you do this? Like, what is this about? And helping them really understand themselves and why they do certain things. And at the end of the day, my job is to help these athletes figure out for themselves, what are their values? What do they care about? And how is these eating behaviors or exercise behaviors either in line or out of line with their values? Because ultimately, when a problem behavior or a behavior comes in clashes with a value, what will change is the behavior, not the value. So that's really, I use motivational interviewing is the main kind of treatment modality I like to use with all athletes for everything at baseline. And because I find it's really effective in really just starting with where the athlete is in terms of what they care about and what they want, and helping them get to where they want. Because most people don't want to have anorexia nervosa. They just
Right.
don't want to. But there's something underneath it there.
Yeah.
And trying to help them peel the layers back and figure out what's going on.
Yeah. I think that's helpful. I do think we do get many clients that come to us talking about the compensatory behaviors where maybe their initial goal to like why they even started doing triathlons or ultra running was weight loss, right? And they will go into their training sessions fasted and or maybe just on a cup of black coffee, and then they'll try and wait as long as they can after their session to not eat, and we from a performance perspective, we know that's definitely not the way to go. From a health perspective, we know that's not the way to go. So yeah, I think that's helpful probably for many people to hear. And where would either for a listener or maybe a practitioner working with someone kind of find that line to then say, hey, this is a point where we need to refer you to a specialist? Like, for example, like if we get someone that maybe we initially think is just unintentionally underfueling, would it be kind of seeing some of those compensatory behaviors, or for a listener, I think it's probably that you mentioned the compensatory behaviors, but when should someone kind of take that step to speak to a professional?
That's a really good question. And I think so it depends. Are we talking about if the individual themselves is noticing it within themselves, or are you noticing it is it one individual noticing it in another individual? Because they kind of require different.
Yeah. Let's
techniques.
Do a case study of an individual noticing maybe the compensatory behaviors that you mentioned in themselves, just skipping breakfast. I mean, should they try and change that, or if they can't change that and they're not willing to change that, then go ahead and reach out?
I mean, I think the key, first of all, is asking yourself why. Why am I afraid to eat breakfast? Or maybe it's not afraid. Why am I not eating breakfast? What's behind it? Is there a fear component? Is there an anxiety component? If so, what is this about? What am I afraid of? This could be so many things. This could be they're afraid of change because they never eat breakfast. They're afraid that they're going to gain weight. They're afraid they're going to get sick in their workout. There could be so many different reasons, but it's really about the person trying to understand themselves and figure out what it is.
Yeah.
If there seems to be a concern that feels not right within them in their values, or, maybe not even in their value system, but maybe they don't feel as well lately, something's happening. I think a first good step can always be going, checking in with their pediatrician or PCP, because you want to find out that it's okay medically, and doctors should have a good sense of, what intake should be. And if they're concerned about the intake, and if they're concerned someone's falling off a growth chart or something like that, then, they may really need to talk to somebody. But if there's also cases where, I've had cases where I work with athletes and for other reasons, like depression or something like that. And then they will say to me, it's weird. I've been like really, for some reason, feeling like I have to exercise every day. And is that okay? Like, I don't know. I feel like I have to. And so I think I, first of all, am a big believer in therapy for everyone. I just think it's so helpful to just, even if you're feeling well and feeling good, just to have somebody that you can talk to about how you're feeling and what, and to better understand yourself so you can live the best life you want to live for you. So I think those are things you bring up with your therapist, and your therapist should have enough knowledge to know if they need to refer out to a nutritionist or get a medical evaluation, something like that. All therapists should have at least the knowledge on how to assess for an eating disorder.
Yeah. How would one, as a friend, from a friend perspective, if they're seeing behaviors or sudden weight loss in their friend, is that something they should bring it up to their friend and try and talk about it? What's the best way to kind of help that person if they're starting to see them just have some rapid weight loss and they know something's going on?
This is so hard, and this happens so much. A lot of the teenagers I work with, they will ask me to, talk with me about how do I talk to my friend because I'm worried about this. Because we see this is a great question, and we see it come up so much. What I typically say is, if there is an actual problem happening, they're likely going to be defensive about it because it's fear. Not defensive in that there's, any negative malintention or anything. It's just that it's scary. The thought of losing control over this is scary. And the thought that someone is noticing may be really scary. So I always tell people if you're worried about a friend, you should express that worry to them as, like, hey, listen, I've noticed you seem like, whatever you're noticing. Are you noticing that they're having less energy? Are you noticing they seem more stressed about food? Are you noticing whatever it is? Tell them what you're noticing in a very non-judgmental and empathic way. And you can say, am I missing? Are you doing okay? Or is there something going on for you? And they may say, no, I'm fine. Everything's good. And that's okay. You can't expect that everyone's going to feel comfortable opening up and being vulnerable with you. But you can always say, like, okay, well, I'm here to talk. And like, if this is something that does ever stress you out, like, I want to hear about it. I want to be here for you. And, kind of plant that seed, because they may not be ready right in that moment, but by you planting that seed with your friend, they may be able to come back to you later on if they do need it. Now, I've seen a lot of cases though where that doesn't happen, and it gets to a point where people notice drastic weight loss in their friends, and they notice maybe purging behaviors in the bathroom, things like that. And we have to be really careful about purging, because the electrolyte imbalance and all the medical complications that can happen from that. Same with if a significant weight loss in a short period of time. So if you're really worried about that for your friend, and you've talked to your friend and your friend is saying everything's fine, and you're still not quite sure, you really, and again, because I work so much with teens, I say you really need to talk with a trusted adult about this and figure out how you can get help for that person, because there really might be something going on, and they could be putting their health at significant risk. So that is a hard thing to do, and there's no right or wrong way to do it. But sometimes people need to go above and talk to either their parent or, and that's really hard to know when to do that. And there's no formula for this, but, hopefully you have a trusted adult in your life that you can talk to about how to do this, so you don't have to make this decision alone about how to help your friend, because it's such a hard thing. And we really want people to feel like when they reach out for help, that it's a positive experience, not feeling like a punitive experience. Because if they feel it's like punitive experience, they're less likely to seek help in the future. So that's why it's a very difficult thing to do, and a really great question to ask.
I can think of a family friend right now where it's hard. You can see something's not right, but the defensiveness is something that you see, and, but they're an adult, and, they're not under parental guidance. So it's, you can't just have the parent make them go to the doctor,
That makes it harder when it's an adult, I think. It makes it much harder. And if the kid's 18, because then rules change. Very hard.
It's a tricky spot. So I think that's super helpful advice though for people, because like you're saying, I think it is maybe more common than we realize. And when it is your close friend like that, so I've heard of people too, just shutting them out, right? It's like, they say they're fine. And then it's like, well, I don't want them asking those questions of me anymore. So like, I'm going to contact them less and be around them less, because they're starting to notice these behaviors. And it's a tricky spot. So kind of stepping away from the conversation of disordered eating and the mental components of that, I want to dive into a little bit of talk on potentially, is there any things you notice in regards to areas of mental distress and potentially having physical manifestations? As an example, like injuries of athletes, just like go. Could you dive into that a little bit?
Sure. We see a lot of overuse, especially now. I mean, from when I was a kid growing up playing sports, there's so much more training happening now than there were when we were younger. And there's this feeling like it's almost like a rat race feeling of like, if I'm not doing every tournament, or if I'm not doing every single, like working out every day and doing like the maximum amount of training I can do, then I'm not preparing myself enough. And to some degree that can be true, but the opposite can happen where you can overtrain, overuse, and then what happens then is that, that's when stress injuries occur. That's low energy availability, injuries, and things can happen. And so I coach younger kids, my own kids, and they're younger, and I always just say, like, we're training for you to be the best athlete you can over your lifetime. This isn't about you as a 10-year-old baseball player being the best 10-year-old baseball player you could be. No, let's the athletic skills and the things you need to have longevity and to enjoy the process of sport and not worry so much about the outcome each year. And I think once we can focus more on like the process versus the outcome, it can help kids really understand and feel and understand the needs of their body more. And if they feel like there's overuse, and be able to make their own decisions about it too. And then that way, as you get to an adult, you start to understand more about like, oh, my legs are so sore, I think I need a break today. And knowing that doesn't mean you're a quitter or you're weak. It means you're smart because you know your body and you know what your body needs to be able to, do the best you can in your next race or whatever it is.
Yeah. Yeah. I think that's a good point. The listening to your body and being able to understand those signals. And I think I've seen athletes that are really good at that. Right. And they've just been trained to like train their body and know their body really well. And then on the other side of the coin, jumping back to disordered eating, you see situations where they've ignored their hunger cues for so long that they don't know what does fullness feel like, what does true hunger feel like, and starting to kind of like hone in and listen to your body. I think Nia has a question. I see her typing in the G doc.
Oh yeah. I was wondering, in the beginning, you mentioned your research currently involves the female athlete and resilience in female athletes. And so I was wondering if you saw any relationship between those qualities and perhaps individuals who, do get injured and then are able to come back. Are there any certain mental qualities or behaviors you see in those individuals?
Yeah, I'm so glad you brought that up, Nia, because that's exactly the study we're doing now.
Oh, cool.
We're looking at about 500 female athletes and giving them a series of surveys, asking them about psychological resilience over a period of 1 year at 4 different time points. And we're asking not just about that, but about other constructs like emotion regulation and things like anxiety, depression, and so many different variables that could contribute, mental toughness, and things like that. So we're looking at that over time, and we want to see what an injury too, as you're saying, and also look over time to it, how that may relate to things like substance use, eating disorders, and other long-term outcomes. Because what we ultimately want to determine is like, what are the active ingredients of psychological resilience in female athletes? Because once we can really pinpoint what those things are that really help people bounce back from adversity, whether it's an injury or whatever it is in their life, what helps them bounce back? How do we figure out what exactly that is? If we can do that, then we're hoping to develop, a program for psychological resilience building, some interventions as well. So that's what we're hoping to do.
Amazing.
In this next year and a half. Yeah.
Wow. So there's definitely a difference potentially in someone's. I'll just give an example. 2 people both get a stress fracture in their foot. One has a bad attitude about it. Maybe, I don't know if that's the best way to put it. And then another person is kind of looking at the long term and maybe taking their time to recover and not trying to push it too hard, or having a more quote unquote positive outlook about it. Can that potentially impact the recovery timeline or process?
Oh yeah. I mean, there's so much work out there on mindset and the impact of mindset on, not just performance, but things like resilience. And this is a little tangential, but one of my Harvard hockey teammates, Allie Crum out at Stanford, she does amazing work on mindset.
Yeah.
She did this really cool study that always sticks out for me, where she talked with a bunch of women who cleaned hotels, and basically the gist of it is that half of them were told that actually working out. Cleaning is actually working out, and the others were not told that. And what they found was that over time, the ones who were told that got stronger. They had, gotten in better shape, and like all these things happen. So it just shows you, like, if you go into something thinking one way, it's going to affect your outcome either positively or negatively. So I think the mindset's a big piece of it, but it's a really hard thing to, and I do a lot of mindset work with athletes, and it can be a very hard thing to learn how to do, especially when things like anxiety or depression pop up and get in the way.
Yeah. I was just listening to Dr. Huberman's podcast with Dr. Aaliyah Crum, and she mentioned that. And the mind is an incredible thing. It is pretty neat. She also shared a study about, it was the same milkshake.
Study.
Yes. And it had the same caloric content, but they told one group it was very high calorie, and they told the other group it was very low calorie, but it was the same milkshake. And it changed biologically how the hunger hormone was released or not released. Right. And it's just super interesting.
That's so interesting. I find that stuff fascinating, and just shows the importance of, investing in mental health of athletes, because there is such a huge, it's such an important piece of not just performance, but just of overall well-being.
Yeah. It is incredible. I know we are getting close on time, and I know you have calls. So we are going to get this kind of wrapped up a little bit. So I'm going to throw a couple case studies at you that I have firsthand experience with my clients. So first one, I'm going to kind of like back up a little bit, just kind of the general, maybe not like race week training situation, but we're talking about just maybe off season. But if we have a client, for example, where do you ever use, out of curiosity, the stages of change model?
Like pre-contemplative, like all that. Oh yeah, all the time. Because that's for substance use work. That's like the, gold standard.
Yes. Yeah. So we learned about that in school and in our clinical dietetics. But so when someone is stuck kind of at that pre-contemplation, or not pre-contemplation, they're contemplating it, right? They've got the information. They said they want to make the change. But they're not making the change. How does one maybe take those steps to enact that change? And feel free to use any form of example in your answer.
This is my favorite work to do. I love this work so much. So this is because the key, it's about values. It's about what do you care about? What do you want to do? What do you want to change? So if you've done a change plan with them and they've identified something they want to change, okay. Let's say it's three, they want to eat their meal plan. Just making that. Okay. Yeah. So they want to be able to do their meal plan. So then I like to do a lot of things like, okay, so how important is it to you right now to make this change? And when you ask them that, you can ask them, like, you can scale it with them. You can say, like, on a scale of like 0 to 10, with it's 0 not important at all, and 10 the most important thing in your life. And let's say they say, well, it's like a 7. What I ask them then is like, okay, well, why is 7 and not like a 5? Because what that then does is they'll start saying reasons for why they want to change. Like they'll say something like, well, it's important to me because I know I need more energy when I'm running. Like I need to, I know it's going to help my performance and I have to do it. Right. So just making that up. But whereas if you say, why is 7 and not a 9? Then they start talking about the reasons against the change. So they'll say things like, well, because like there's other things in my life that are more important right now. I'm also not really sure I need to do it,
Yeah.
And the fact of the matter is when you're doing therapy with people, it's not what you say to them as the therapist, it's what they're saying in the presence of you that makes
Yeah.
the change. So
Yeah.
your whole goal as a therapist is to help that person to understand themselves and hear themselves speak about themselves and what they want to see differently, because they're the ones who are going to be talking themselves into change.
Amazing.
So
Yeah.
I like using the rulers. For me, that often helps. I also like using skills like looking forward, like where you might say, okay, so if you keep eating like this for, the next month, where do you see yourself in a month? And then what about a year? What about 5 years? And so then sometimes it takes them to really look ahead. And if they keep restricting, what's going to happen to them? Because a lot of the college athletes I work with, they feel like it's fine right now, to do it. But then if they think 5 years ahead, some of them are even thinking about, oh, maybe I want to have kids.
Yeah.
And I haven't had my period, so I won't be able to have kids. So it's kind of like we need to really get creative and think outside of the box when we're working with these people to find motivators for change. And it's not a simple question like, why do you want to change? Like you have to kind of really work around it in a lot of different ways, which is why I love the work, because it's really challenging. And it's if you get a breakthrough, you're like, oh, this is awesome.
Yes.
This is, you got it. This is so cool.
That is amazing. Okay. I'm going to jump to our next case study. I think we could dive into that topic for so long, but I want to be mindful of your time. So next case study situation is kind of like right in the moment. I'm talking in a race, an athlete has all their nutrition dialed, but they get a flat and now they're kind of like behind the pack. I'm talking triathlon situation. What can one maybe plan on or think about trying to do in that like moment to try and like not go into the whole like, oh, I'm behind, this is like I'm gonna, what can one do in that situation?
I'm such a big believer in process versus outcome and staying in the present. So like in controlling the controllables, you can't control it, you just got a flat. So let's just move on. And what can we control? Being in the zone right now, doing what you need to do in that race, wherever you're at in the race. And a lot of times too, like it's a matter of when they see themselves start spinning in their head of like, oh my God, what if this, what if that, like when all those what ifs come about, it's teaching them how to notice, okay, I'm doing the what if thing. This isn't going, how does it serve you? It usually never does.
Right.
If it never does, then you need to train your brain to go into to focus on what you're doing. Look ahead. What do you see? Really engage yourself in the present and battle that way. But it's not easy. Like a lot of times people are like, well, like it sounds so easy, but in the way you say it, but it is so hard and it takes practice to really take yourself out of your head and into the race, into the moment.
I love that. Amazing. You have been an excellent gem. And I feel like I could like take so much of your time, but I want to be respectful. So I just have one wrap up question, and then I would love for you to let people know where they can find you. But where do you see mental health in athletes, or how do you see mental health in athletes changing over the coming years and kind of going into the future? Do you see the stigma being lessened of like going to therapy, or where do you see that going?
Yeah, I definitely do. I see it mental health becoming synonymous with physical health, like that it's all one thing.
Yes.
And that we treat it as that, because our mind and our body are inextricably connected. Like it's sometimes hard to tease apart what's happening.
Yeah.
And your mental health is just so key to your well-being.
Yeah.
So I don't know why we're ignoring it. It's kind of dumb if you think about it. So, I mean, I think for me, I do see this changing. It's so different from when I was a kid growing up. And I think it will keep changing. But I think what needs to happen is we have to stop reacting when bad things happen to people's mental health and then doing something after the fact. And instead, we need to be proactive about it and incorporate it into every single college athletics program, every single high school, every single elementary school youth program. Mental skills, mental health is a part of sport. Yeah. And it should be treated as a way to have an advantage too. Like if you've got a healthy mind, you're going to be competing better.
Yeah.
And so that's kind of where I see it.
I love that. Okay. Where can people find you? Kim works with people one-on-one. She's obviously amazing. Where can people go find you to work with you?
Yeah. Oh, I guess if you want, like, if you're looking for, if you're an athlete looking to for a therapist who is also an athlete, you can go to our group mental health practice. It's called Unlimited Resilience, and our website is unlimitedresiliencellc.com. If you're, I don't know, looking for training or consultation or anything, you can go to my own personal website, khmobrien.com.
Awesome.
And I think my emails and everything is on there, and yeah, more than welcome
Perfect.
to contact me. And yeah, happy to help however I can.
Amazing. We will include all those links in the show notes for everybody listening. And amazing. Thank you again so much, Kim. I feel like we could do a whole part 2 series on this, but I want to let you go get to your client. So thank you again. You have been wonderful.
Thank you. I really appreciate you guys having me.
No problem.